how to get a more natural six-pack and a chest-pack appearance. In other words, how to create a more natural, high-definition look to once you undergo a liposuction procedure for your body. So, to start off with, in order to get the best results of a six-pack, you need to be reasonably healthy. I'm not saying you need to be perfect body shape, but you need to be reasonably healthy, and that means less amount of visceral fat. If the visceral fat is too much, wherein you've got a big bulge on the top of your abdomen, the results will not be as great till you lose that visceral fat. So the first condition to getting a great result is the least possible visceral fat that is possible. So if you have a doubt whether you have visceral fat, just share your pictures with us and we'll guide you to the suitability of doing such a procedure. Second thing is the competence and the skill of the operating surgeon who is going to create your six packs. The whole concept of high definition surgery was started by Alfredo Hoyos, who is my teacher as well, and he created that whole concept of putting these packs on top of the original muscle. So about 12 to 14 years back, he started the concept of high def surgery, wherein the etching would be done in such a way that they would overlap the natural muscle outline, and therefore even if you moved, the packs would look normal, they would not stand out. So this concept ran for a very large number of years till he came out with the total definer concept. And in the total definer concept, he started talking about injecting fat into the muscle. So it's a very interesting concept, and we've now been doing it for almost a year. Understand this in great detail. We inject fat into the rectus muscle. Now the rectus muscle may have 4 or 6 packs, and each rectus muscle has its intersections. So they have these lines which are the divisions between the muscles. When we inject fat into the muscle, fat would get deposited here, the intersection would not have fat, then fat would be here, no fat, and then fat. In addition, we are doing some etching on top of the skin as well, and therefore after the surgery, what you're seeing is an augmented muscle. The muscle itself becomes more thick. In a way, it appears that the muscle has gone to the gym and become bigger. What does a patient get because of this new concept? The etching defines the outer margins of the muscle, the inner margins of the muscle, and the fat injection creates a hypertrophic muscle or a more thickened muscle. Now, suppose you gain weight or lose weight, it does not make too much of a difference because the muscle itself is more hypertrophic. It is bigger. So if you lose weight, the muscle itself is already thicker and you will still have good packs. If you gain weight, unless it's too much, you will still maintain that normal body shape. And of course, because the muscle is being injected, so if you're moving, moving like this, or you're running, you would still have very natural looking six packs. So that is the whole concept, the most modern concept of six pack surgery that we are doing now, and this concept has now been transferred onto the chest. So how do we create a very natural looking chest shape, a chest pack kind of a shape, which at Divine we call as the 360 square technique? The whole concept is very similar to the total definer concept of Alfredo Hoyos. I've just modified it in a bit for our Indian patients. So what we have seen, our Indian patients, they don't go to the gym that much, that intensity is not there. So we have to create really high definition chest packs. And how do we do that? Is that now Alfredo Hoyos is my teacher and I've learned this whole concept from him, but how we have enhanced it further is that we have started creating very deep deltopectoral grooves here. So the outer edge of the muscle is very deep. We've started creating a groove below the clavicle bone. So a deep groove is created here. So that defines the upper end of the muscle. And then we've started creating a box kind of a look in the inner part and the lower part. So this part and a deep groove in the middle of the chest as well. So how it appears is that the rest of the area around it is depressed, whereas the chest is actually protruding bigger. Fat is injected into the muscle. We normally inject 250 to 300 ml of fat, which we have taken out from your body. and we define that fat is injected again into the muscle, not over, not below, into the muscle, and therefore it takes the shape of the muscle. So anytime we are injecting fat into the muscle becomes thicker, and it is the shape of the muscle which is developed. So that is the whole concept of the 360 square technique, and we are getting amazing results, beautiful muscle outlines, really augmented chest. And if the patient chooses to do further gym, they will get this look. They will even actually enhance this look more. The recovery is really quick. Within 2 or 3 days, you are almost back to normal life. Gym can actually start within 15 days as well. So these are very comfortable procedures, quick recovery procedures, and very satisfying procedures. How have we also extended the whole concept of high definition onto the other muscles of the body? So for example, we can create the deltoids, we can create the biceps, we can create the triceps by extending this whole concept of injection of fat into the muscle and defining the edge of the muscle. So for example, if I have to create the deltoid, I create a very deep deltopectoral groove. I extend this groove right up to the shoulder and back as well. So here I define the deltoid. So we all know when you do this, you've got the deltoid muscle when you press this, and the deltoid groove is extended right till the back. And at the margin of the lower part of the deltoid, we create a groove which goes right back, and then we inject fat into the muscle. So again, the muscle becomes bigger. So the old concept of injecting fat into the skin is now dead. We don't do that anymore. Same in the biceps, we define the edges of the biceps completely. So before surgery, we mark out. So for example, this is the bicep, and then we completely mark out and then inject fat into the biceps. For all our patients, we've even extended this concept to the back. So what we have done now is that we are now injecting into the trapezius muscle as well. So trapezius starts from here. So we can actually augment the trapezius and give you a heavier look here. So it gives that big body macho type kind of a look. And towards the back also, we are now injecting into the trapezius muscle all along the back, and it gives you a very nice highlighted back. So you can ask us to do the trapezius look as well. So the trap fat injection is now a reality, and we've started doing that here as well. The lower back muscle is also created in order to give that nice lower back contour. An interesting thing is that there was a concept of a footballer's buttock. What does that mean? Firm, tight. So we actually do a little bit of fat injection into the buttocks in men as well, not to enhance it. No, the whole idea is to give it firmness. So you can ask for it during your procedure, during your consult, that you'd like to get that done. And overall, when you're wearing shorts, tight shorts, or you're in the gym, it gives a firmer appearance to your buttocks. So this whole concept of working on a high definition on the entire body is now a reality. And we feel fortunate that we've been able to create amazing results with this kind of a procedure.